Interfascial Synkinesis. Definition. Synkinesis is the result of miswiring of nerve after trauma. This result is manifested through involuntary muscular movement accompanying voluntary movement. For example, voluntary smiling will induce involuntary contraction of the eye muscle, causing the eye squint when the subject smiles. Facial synkinesis is a common sequela of the idiopathic facial nerve paralysis, also called Bell's palsy, or reactivation, which can lead through unknown mechanisms to diffuse axon demyelination and degeneration of the seventh cranial nerve, result in a hemifacial paralysis due to non-functional nerve.
Practical DVD demonstrating techniques and exercises to manage your facial palsy once it has started to recover. You should not be doing these exercises if you have had your facial palsy for less than 3 months, as that might be more than good. If you want to read more about facial palsy, including why it happens and how the facial nerve works, then please visit the Facial Palsy website at www.facialpalsy.org.uk. The Facial Palsy website also has details of support groups which you can attend across the UK. Not all exercises are suitable for all patients, therefore this DVD must always be done under the guidance and supervision of a specialist therapist. Please note that when you first start doing your massage and stretches, it can be painful due to the tightness in the muscles. This will ease with time, as long as you continue to do your exercises regularly. Some patients describe this feeling as a bruised, tender feeling. Once your face starts to recover, you may notice different things about your face. For example, your affected eye may seem smaller, and the corner of your mouth may seem raised rather than low. The cheek itself may start to feel stiff at times. Overactivity on the affected side as it recovers is common. This is called synkinesis. It's caused by the nerve cross-wiring as it regrows. The muscles all work at the same time, whether you want them to or not. This makes the face likely to be tight and stiff. Having all the muscles working at the same time restricts your movement, as they work against each other in a tug of war. Special exercises can help change synkinesis, and therapists will show you how to do these. Here is an example of synkinesis. You will see that as the patient smiles, their eye movements slowly, and as they resolve, their eyebrows heal. Please avoid using any electrical stimulation on your face, as this can make synkinesis worse. This includes any electrical beauty treatments, such as casing.
Pros and cons. There are no pros in this disease. The most common symptoms of facial synkinesis include eye closure with volutational contraction of mouth muscles, mid-facial movement with volitional eye closure, neck tightness, platysmal contraction with volitional smiling, hyperclarimation, also called crocodile tears, a case there are eating provokes excessive lacrimations. This has been attributed to neural interaction between the salivary glands and the lacrimal glands.
Hello, I'm making this video for all the people that keep telling me, oh Kim, Your face looks fine. I don't see what you're saying is wrong with it. It looks perfectly normal to me. Well, I'm going to show you how not perfectly normal it is. So watch closely as I close my left eye. Be on the right of your screen, obviously. See? My mouth twitches involuntarily. I'm not doing that on purpose. See, my right eye, if I close it, no movement in the mouth, because your mouth is not supposed to involuntarily move whenever you close your eye. Next thing, closed mouth smile. Notice the ropey muscle on the left side. It's not supposed to stick out when you smile. And mine does. And also my eye. My left eye looks kind of funky. No, that wasn't part of it. That was just me being silly. So, what else? Oh, open mouth smile. It's like Popeye the Sailor Man. I need a corncob pipe or something to stick in the left corner of my mouth, and then I'll look normal. Well, as normal as Popeye the Sailor Man looks. So that's about it, except for kissing. See, I can't kiss. I can't kiss normally. I would love to kiss you right now, but I can't because my mouth doesn't work right. So yes, it's very much better than it was a year ago at this time, and I'm thankful and grateful for that. But it's still not normal. So I just wanted to let you know and show you exactly what I was talking about. So see you later.
Application in medicine. Experimental research for treatment has been mostly focused on facial synkinesis due to its abundant prevalence compared to extraocular synkinesis. Additionally, since the extraocular muscles are hid between the orbits, there is a limit of the type of practical treatment that can be established, for example massage. Established treatment for synkinesis in general includes surgery. Furthermore, facial synkinesis had the benefits of less invasive treatment such as facial returning, biofeedback, mime therapy, and Botox.
This is a practical DVD demonstrating techniques and exercises to manage your facial palsy once it has started to recover. You should not be doing these exercises if you have had your facial palsy less than 3 months, as that might do more harm than good. If you want to read more about facial palsy, including why it happens and how the facial nerve works, then please visit the Facial Palsy UK website on www.facialpalsy.org.uk. The Facial Palsy website also has details of support groups which you can attend across the UK. Not all exercises are suitable for all patients, therefore this DVD must always be done under the guidance and supervision of a specialist therapist. Please note that when you first start doing your massage and stretches, it can be painful due to the tightness in the muscles. This will ease with time as long as you continue to do your exercises every day. Some patients describe this pain as a bruised, tender feeling. Once your face starts to recover, you may notice different things about your face. For example, your affected eye may seem smaller, and the corner of your mouth may seem raised rather than droopy. The cheek itself may start to feel stiff and tight. Overactivity on the affected side as it recovers is normal. This is called synkinesis. It's caused by the nerve cross-wiring as it regrows. The muscles all work at the same time, whether you want them to or not, and this makes the face likely to be tight and stiff. Having all the muscles working at the same time restricts your movement, as they work against each other in a tug of war. Special exercises can help change synkinesis. Your therapist will show you how to do these. Here is an example of a patient with synkinesis. You will see that as the patient smiles, their eye closes slightly, and as they whistle, their eye narrows.
The Embassy of Ecuador in Argentina, within the framework of inclusion policies and public diplomacy, made a presentation on the country and the Foundation for Persons with Synkinesis and Environment, Interfascial, aimed at patients affected with facial synkinesis or IPAR due to a brain injury, who can receive eternal and subjective questions.
A few years ago, I got Bell's palsy, which paralyzed the whole right side of my face. I couldn't use the taste buds on the right side of my tongue. When the nerves started to grow back again, they regenerated in such a way that I developed synkinesis. And that means that if I use one part of my face, another part of my face moves involuntarily. So to show this, look what happens when I blink my right eye. It actually pulls up my whole right mouth, right side of my mouth like that. So my left side is just normal. Now the opposite happens as well. If I move my mouth, then my eyebrow raises. It doesn't happen on this side. You'll also see that if I move my mouth, that the muscles around my eyes kind of move around like that. What you can do, one of the things you can do is try to retrain your face. So keep your eye still while moving your mouth, but I didn't really have any success doing that. And so I lived with it for 7 years, and then I thought, okay, I want to do something about it. I went to my doctor, referred me to a neurologist who said, okay, you can get Botox, so that will freeze parts of your face. So then when you move your mouth, that remains stationary, and so that will actually help retrain the muscles in your face and the nerves in your face. And so I've already actually got one lot which did basically nothing apart from now the Botox worked here and I can't actually squint. But as for everything else, it just moved like normal. But the neurologist said, okay, you just start at a very small dose. So next time I get Botox, it'll be a higher dose, and hopefully it will have some positive effect on my synkinesis. Okay, I got my second lot of Botox a few weeks ago. I've waited that long because that's how long I was told Botox takes to take effect. A lot of people think, okay, it works straight away, but it actually takes a little while. Now, I did get 60 units this time instead of 30 to 40, so I was hoping for more substantial results. I did get some in some areas. One thing I didn't discuss last time is that I get a bit of nerve pain in my chin and a little dimple. That was injected and that seems to have fixed that problem. I also seem to get some nerve pain across here, and that was injected. Now I think I've had fewer headaches since then. Finally, my smile is a little bit more symmetric, I think. When I smile, it's a little bit more straight across. Before, when I smiled, this engaged and I pulled up my smile like this. However, the thing I want to fix the most is still a problem, and that is my eyebrow raising when I smile or use the right side of my mouth. So you can see it's still going up like that, and the other side it stays the same. You can probably see this better in a photo. So this first photo here, I'm just all relaxed, and you can see the eyebrows are reasonably level. However, when I'm smiling in the second photo, you can see there's quite a bit of asymmetry in the height of the eyebrows. So hopefully, when I do the third part of this video, I will have more Botox into this area, and that problem will be improved. Okay, so now I've had 3 Botox treatments. I've got good news and I've got some not so good news. The good news is that my synkinesis has decreased significantly. Look, so when I close my right eye, the right side of my mouth, it only goes up a bit now. And when I smile on that side, the eyebrow stays reasonably stationary. My right eye closes more than it should still, but it's drastically improved. Now let's have a look at my smiles. You can see that my eyebrows are significantly more symmetrical than they were after only 2 Botox treatments. However, the bad news is that I have actually received too much Botox in my cheek and next to my nose. So you can see when I'm smiling, my nose is quite asymmetric now, and the amount of my teeth that are showing is significantly different on my left side of my mouth and my right side. However, a good thing about Botox is that it does not last forever. In a few months, it'll go back to how it was, and next time, the neurologist will be able to tinker a little bit and put less Botox next to my nose and in my cheek, and still do the same amount of Botox above my eyebrow. So, yes, there will be a next time. Overall, I am happy with the experience. I have seen positive results. I'm getting less headaches, and I've got more symmetry in my opinion. And it's free. If you live in Australia and you need Botox for a medical condition, then you get Botox for free. So I'm going to continue getting it.
Conclusion. Facial synkinesia is one of the most distressing consequences of facial paralysis. Synkinesis refers to the abnormal involuntary facial movement that occur with voluntary movement of a different facial muscle group. The pathophysiology basis of facial synkinesis is like multifactorial. Also, the predominant mechanism appear can be aberrant regeneration of facial nerve fibers to the facial muscle groups after facial nerve injury. Patients experience hypertonic contractures and synkinetic movements such as eyes closure with volutational movement of the mouth or mid-facial movement during volutonal or reflexive to eye closure. Synkinesis can cause functional limitation with activities such as eating, drinking, smiling, and may even lead to social isolation. Evaluation of synkinesis is primarily subjective with facial grading scales such as Sunnybrook scale.
Patients often complain of their faces feeling tired and tight, especially towards the end of the day. When you have synkinesis, it can be very hard for your face ever to relax completely. It's a good idea to build in periods of relaxation practice throughout your day. It can help to touch your cheeks to make sure they are completely relaxing. Before starting your relaxation, make sure you are sitting comfortably in a well-supported chair with your feet flat on the floor. Touch your cheeks with your hands and use the weight of your hands to help your cheeks drop and relax. Look down towards your lap, but don't close your eyes. Breathe in through your nose and out through your mouth deeply to help you relax. Try to zone out and let your face go floppy. Some people describe this as letting your face go into neutral. Try to spend 5 minutes 3 times per day relaxing your face in this way.